Hi, my name is Dr. Christopher Scott. I'm a psychologist. I'm a certified Gottman couples therapist and a certified sex therapist practicing here in the Houston area. And today I'm going to be talking a little bit about how to make therapy successful. Now I'm going to be talking about two kind of basic areas here that are important with success in therapy. And the first is your relationship with your therapist, and the other are some common factors that lead to early dropout in therapy. So first off here, your relationship with your therapist. Probably one of the most important parts of whether or not your therapy experience is going to be successful. Now I want to say at the outset that not every match is a good match with a therapist. So it's really important to try to find a good match before you even start. Try to ask folks if they offer a free consultation, read about how they work on their website, but if possible, try to talk with them before getting started, because you're going to have a good feel for, would I be able to work with this person? Now, what's really helpful during the process is to be able to give your therapist feedback. Now, in my practice, I'll typically give many assessments to look at progress and treatment, as well as evaluations of me and my work that I'm doing with my clients. So I encourage folks to be really honest in those. And it's really helpful that if there is a part that they can write out or type out regarding qualitative feedback about our work, that you take that opportunity, because the more information I get, the more I can change my work with you and perhaps my other clients as well. Now, not all therapists give feedback forms, and I do encourage you to, in those cases, to maybe use your secure patient portal to send messages maybe before each visit to say, here's how I felt the last visit went, here's my feedback, let's talk about it in our next session. That can be really, really helpful. As therapists, we're trained to be able to get constructive feedback from clients. And I would suggest that if your therapist is having a hard time hearing your feedback, that maybe this is an indication that maybe this isn't a good match. But all in all, this is something that we should be able to talk about with our clients. We get specific training in school, and while we're human and have egos, this is something that we really get the most improvement by, is getting that information. So I want you to lean into, if there's any hesitancy, any worry. Maybe sometimes people feel, well, my therapist is too nice and I don't want to tell them that I want to talk more about methods, or I want them to challenge me more in session. That's okay and really, really helpful. Now, the next part here is talking about premature dropout in therapy. And there's a number of factors that I want to address and maybe hopefully find maybe there are antidotes for that. The first one here is shame. A lot of people come to therapy with a huge amount of shame, whether that comes from trauma or whether that comes from our own behaviors, maybe not living up to our own standards and values. Shame can be a very powerful force, and a lot of people, when they begin to open up, feel a surge of shame and might be tempted to just drop out and not continue therapy. Now, I want you to lean into those edges and talk about your shame with your therapist, because that could be even part of your treatment plan. The caveat here I want to add is, if your therapist directly criticizes you or expresses contempt towards you, that they're stoking that shame. They're exhibiting disapproval and such. I want you to take a moment and ask, will I be able to establish a trusting, safe relationship with this person or not? If you feel not, then I think it's okay to switch therapist. I would encourage you in those cases to maybe have a short closure session to maybe give some feedback and I'll let them know that maybe somebody else would be a better match. That could be really, really helpful information. Now, the next area I'd like to talk about is motivation. This comes up a lot, especially when I'm doing couples work. It's very common for one person in a couple to be really motivated. They may have wanted to do therapy for years before starting couples therapy, whereas the other person may feel a little ambivalent about it. Now, sometimes low motivation might come from shame, like we talked about earlier, and there might be other areas as well. And I think it's really important when you're doing this work to let your therapist know that maybe you feel a little ambivalent about some parts. Part of my job is to assess that with folks and to find where the yes is, where can we fully invest, and if there's ambivalence, to acknowledge that. And there's probably some good reasons for that. And we'll even talk about that a little bit later when we talk about hopelessness. So next I want to talk about is having excessively high expectations, or an idea that therapy is going to be quick and easy and not require any effort, because that's not how it works. It's going to take some time and it's going to take some effort. In fact, the more time and effort you put into it, the faster you're going to meet your goals and the more satisfied you're going to be. So I do have folks that sometimes come in believing that, like, okay, I'll have a couple sessions, my life will be completely different, or other people in my life are going to change, even if I haven't changed, and it's going to be easy. That's not exactly what's going to happen. A lot of therapy is recognizing that there are some things within our control, particularly our behaviors and how we think about the world and the work we do around our emotions and how we communicate. Those are things within our control, and then recognizing there's a lot outside of our control and being able to accept those parts that are outside of our control. And that takes hard work at times. So I want you to set realistic expectations. Understand that the aspects that you have the most control over and the aspects that you put time and effort into changing, you're going to see the most yield with those. If you're having really high expectations that other people are going to change, or that things are going to not require any effort at all, you're probably going to be disappointed. So next, let's talk a little bit about hopelessness. Hopelessness sometimes comes into play when I'm working with people who are really depressed, or when I'm working with couples that are really kind of on the verge of breakup or divorce. Now, hopelessness is a powerful protector. It protects us against disappointment. It also protects us from investing when perhaps maybe we aren't going to be able to turn things around. And I want to honor that. However, we don't want our hopelessness to become a self-fulfilling prophecy. So if you come into the process of therapy, I want you to maybe hold on to some of that hopelessness, but to be able to look at that if we're really going to see if we can give this a chance of working, that we need to really try to keep a little bit of hope there, as well as really put our time and effort into the process. Because if we're so hopeless that we don't put any time and effort into it, we're not going to see any change. And that's just going to, again, become a self-fulfilling prophecy. Next, I'd like to talk about relapse. Relapse is a very real thing, whether it's changing a habit or addiction, or relapse like with a relationship that things are starting to improve, but then we have a setback. I find that relapse takes kind of two forms in the therapy I do with folks. First off, with folks who are highly avoidant, or if there's a relationship concern where there's avoidance, where for instance there's a lot of conversations that aren't happening, a lot of avoidance and such, that relapse is going to come up relatively early there. That there might be a little bit of hope, maybe some momentum, maybe even things are getting a bit better, but then what happens is that we have a setback. That is normal. In fact, it's probably going to feel a little bit like a roller coaster ride at the very beginning. So keep in mind that that is going to be part of the process. It's going to feel like 2 steps forward, 1 step back at that point. Now, the other form that I see relapse oftentimes taking play in is when we've done medium to longer term work. We may have eliminated a habit that you've been concerned about, or really made significant improvement in a relationship or your sex life or some area, and things are going great, and then there is a setback and it really, really feels awful. The important part is not to engage in blame of other people or yourself, or to get so hopeless that we want to give up. To kind of look at that this is a normal part of the process. When I'm working with people with habits, temptation is part of life. That's going to come up for us. When I'm working with people around relationships, conflict will occur. In fact, any relationship worth having will have conflict in it. So relapse is expected, and it's important to be aware of that. In fact, I oftentimes do a lot of preparation work with folks around relapse as we move along in our process. Now, the last area I want to talk about is financial problems getting in the way of therapy. Now, therapy can be a big investment in time and money, and it's important to assess, will financial problems be a significant barrier to continuing therapy at the outset and during the process. And it's important to let your therapist know that. For instance, I've worked with folks where maybe what we'll do is we'll do some intensive work on really trying to improve an aspect of the relationship or change a habit or an addiction. And then what I might do is maybe give them some self-help tools, or perhaps refer them to a sliding scale provider for maintenance work. I think communicating about this early and often with your therapist can really, really help with continuity. Now, just to kind of review all this, the big picture here as far as reasons for dropping out early and their antidotes is that it's your choice whether or not you want to continue with therapy. But I do encourage you to give consistent feedback to your therapist, as well as if you're thinking about ending therapy earlier than expected, to be open to having at least a short visit to talk about what went right, what went wrong, any feedback you have for your therapist, and then next steps, as that's going to really help you in your journey. I really appreciate you joining me for this today. And if you want to contact me, you can do through my website at www.scottpsychologicalservices.org, or you can reach me by email at drchristopherscott@gmail.com. Thanks again for joining me today. Bye.